With the Diabetes Association talking with us, and Miss Carol, I'm going to give it to you and you could tell them what you are talking about next.
All right. I'd like to bring up, since I know that a lot of women listen to this show, I'd like to bring up the gestational diabetes and what that is. So gestational diabetes can happen to a woman when she's pregnant. And so that's why they give you that lovely juice, that glucola, to drink, to be tested during your pregnancy. But it's so important that you take that test, because if you develop gestational diabetes, it can have life-threatening ramifications on the baby. The baby could die. The baby could be born with a respiratory distress. And it's just nothing to fool around with. It can also affect the life of the mother. The mother can develop preeclampsia, which can also be life-threatening to the mother. High blood pressure can result in stroke. So it's just nothing to mess around with. Make sure you're tested for gestational diabetes.
Right, and I think earlier you were stating that so many women, period, take care of their families and jobs, and they do not take care of themselves.
We hear this all the time. I mean, it's just our nature as mothers to take care of everyone else before ourselves. But we have to look at it as the flight attendant tells us on an airplane, right? When the oxygen comes down, you put your own mask on first, because if you can't breathe, you can't help the person next to you. So if a mother isn't taking care of herself first, how can she be there in her full to take care of her family? So if you have diabetes, you need to manage it well. You can't just, eat whatever and not check your blood sugar because you're worried about getting your child off to school or fixing dinner or getting to work or whatever. You need to take that time because your family needs you.
Exactly. I totally agree with that. I totally agree. Ladies, get yourselves checked out. Get your A1Cs checked, because that's the most way to do it. Do not just do the finger stick, tell me you want an A1C and your blood sugar checked, because that needs to be done. You never know. You may have it, been living with it. What did you say earlier?
You can have 5 to 7 years type 2 diabetes and not know it until symptoms start, and then you may have complications.
Wow. And on the break, I had asked you, what was the youngest someone could have diabetes?
Infants. So, yes, diabetes can develop. Now, that would be type 1 diabetes. You're not going to see someone that young develop type 2, although there was a child in Mexico as young as 3 who developed type 2 diabetes because the child was that overweight. Wow. So, the child, there is no cure for diabetes, type 1 or type 2. And so at whatever age you're diagnosed with it, you're going to have to live with it from that point on. The thing is about type 2, about 60% of people can prevent it from happening, or maybe at least delay the onset until they're much, much older. And so to think of a child developing type 2 when maybe that really could have been prevented is really sad, because the complications of diabetes are the same whether it's type 1 or type 2.
Right.
And we haven't really talked about complications. Do you want to address that a little bit?
Yes, we do. Yes, we do.
So diabetes is the #1 cause for heart attack, stroke, blindness, kidney failure, and lower limb amputation. And that's because you need to think about when your blood glucose levels are high, your blood is like molasses trying to get through your veins. And where in your body do you not have veins? So if your blood can't flow nice and easily and slowly through your body the way it's supposed to, then that causes damage. It breaks down the vessels and so forth. And so that's why diabetes literally affects a person from head to toe, because you have blood vessels that flow everywhere. And it's the same way because the sugar attaches itself to the nerves. And so if you have nerve damage, then you may not feel your feet. You may get a cut. Bacteria could enter even through a tiny little micro cut, like if you trim your toenail and you accidentally cut your toe, bacteria could get in, cause an infection, and then that may lead to lower limb amputation. It happened to my aunt. She lived out the last of her life without her legs. So the complications are very serious. What we know is that it's the 7th leading cause of death in Indiana. It's the 5th leading cause of death for African Americans. And the thing is, diabetes is often not on the death certificate. The death certificate probably says kidney failure or heart attack. Well, what caused those things to happen? In many cases, it was the diabetes that caused that. So the complications are real. and people need to understand that.
Yes, they do. That is serious.
That's my
that is
kind of my
serious.
Debbie Downer part of the message. But everybody needs to be aware so that they take it more seriously.
Okay, and is there anything else as far as complications or prevent? Yes, did we talk about prevention?
We haven't talked about prevention yet.
Okay.
But that's a good thing to talk about because, like
Okay.
I said, many people can prevent type 2 diabetes from happening. There's nothing we can do to prevent type 1. Type 1 is maybe generally caused because of a virus or something that attacks the pancreas. Type 2, however, 60% or so people can prevent it from happening or maybe delay the onset until they're much, much older. And so it takes healthy lifestyle, physical activity, those things that we hear over and over again to prevent that diabetes from happening. Genetics plays a huge role in type 2 diabetes, however. And so there are some people that they may be a triathlete and just as fit as they can be, but if they have a strong family history of type 2 diabetes, they may develop it anyway. So there are some cases where type 2 cannot be prevented, but that's not the majority of cases.
Now, I do have a question. What would you tell someone that has a family member or a husband, wife, child or something that does not like going? You know, men don't like going to the doctor.
No,
so
they don't.
how would you try to persuade them to kind of go and get this checked out? Because especially if you know their family has a history of it.
Right. You know, I might try scare tactics. Honestly, showing them pictures of what these complications look like.
Mm-hmm.
Or, you know, do you really want to have a stroke and live under those conditions where maybe you've lost part of you've been paralyzed and you can't use your arm or your leg, or maybe you can no longer converse with your family? Do you want to run the risk of a heart attack and die and not be there for your family? Scare tactics. I don't know what else to do sometimes with these men.
Well, hey, none of us know what to do with it. HB, what do you got to say to that?
I think we need to take a break and go to the music and listen to this great sound and then come back and find out more about diabetes and what you need to know on radio.
I will be back, guys.
TV.